Today I'm going to talk about EWOT, exercise with oxygen. Have a system here, have my standing bicycle, oxygen concentrator, and reservoir, which we fill up until it's as big as it gets, about 900 liters of oxygen. On my finger we have an oximeter, very convenient not only for this therapy, but to diagnose your oxygen levels in your blood. Right now mine is 95%. I'm 66 years old. Could be better. Could be better. I'm going to be putting on this mask. So I'm going to do it right now and then I'm going to come back and be talking. So, put my mask on. Simple. Could be a bicycle, rowing machine, could be a trampoline, anything to get your heart rate up. I ended up just in 30 seconds of doing the exercise, got my heart rate up to 100 and my oxygen level up to 99. Maximum, of course, is 100. This is the Maxx O2 system. There are two other main companies in this business. One is Live O2, which I started with. It's still in my anti-inflammatory oxygen therapy book. There's this, which is the superior system. And then Michael White on, I forgot the name of the site, breathing.com. He has a less expensive system bag, Live O2 and this system, comparable in price. Nobody can compete though with the quality of this unit. It has a it's material, very good material. It's welded shut with the Live O2 is sewn, meaning you can fill this up at night and it'll be totally full the next morning. No oxygen leaks out. Has a rib cage, so when the bag gets close to being empty, the rib cage puts pressure on the bag so oxygen still flows easily out. This is a wonderful therapy. It saved my life. 5 years ago, I had a near-death experience. One of these EWOT systems got delivered to my house. 1 week later, I didn't even have my bicycle till the next day, and I could hardly walk to the bathroom, and yet I strapped my mask on and I ran for my life, ran to get oxygen. And this system has been with me, been doing it on and off for these 5 years. I'm not as disciplined as I could be or should be with this system. It's exercise is very important for everybody, especially cancer patients. Cancer patients who exercise have better outcomes. The beauty of EWOT, exercise with oxygen, is your oxygen assists your exercise. You're getting you get your heart rate up as high as you can. Of course, you have to get out of bed. People in ICU cannot use the system. You get your heart rate up, you get your lungs functioning, pumping, exercise creating a lot of CO2, which allows safely for a lot of oxygen. And when this is full, I can breathe this whole bag in 17 minutes. But the therapy is 15 minutes. You can do it once a day, twice a day, even 3 times a day. It's strong. It's very strong. This is one of the strongest therapies that I think exists in the world of medicine. Oxygen can be dangerous if it's not accompanied by CO2, high CO2 levels, and hydrogen. Hydrogen therapy, hydrogen makes oxygen safer, and CO2 definitely makes it safer. Originally, this therapy came from Europe, which has been used for about 20 years, but it was not this system, not powerful like this one. What the original therapy was is just using an oxygen concentrator. This is 5 liters. In the old system, you'd have to get a more expensive one, a 10-liter system or 8 to 10-liter system. Have a small tube, and you put the small tube into the mask. You get on the bicycle, and you breathe directly 10 liters, 8 to 10 liters a minute. You would need many hours of therapy this way to compete with this. The advancement of the system, which I was involved in the development, and it's evident in my anti-inflammatory oxygen therapy book, was that you fill this bag up with 900 liters. This system takes 3 hours. You have a huge reservoir. Then you have this big tube coming out of this system. So you're breathing in, instead of 10 liters a minute, you're breathing in everything you're using. If you're using 30 liters or 40 liters a minute, you're getting all the purified oxygen with this method. So it's in 15 minutes, you get the same results than hours of the old system. The other type of EWOT is called contrast training. I don't have it, I've never used it, but it's a system that simulates high altitude training. So you set the unit to low oxygen, which is what you have at high altitudes. You get on, you start exercising, and your body starts starving, becoming hypoxic, starving for oxygen. Then you flick the switch and a wall of oxygen comes in and rams into the capillaries. This particular company, Maxx, has just come out with a brand new contrast system, something that has never existed until this past month. It is based on a new type of oxygen concentrator that you can set. It's like 10 liters a minute. And you can set the control to the altitude from 0 to 25,000 feet. So you can set the controls to regulate exactly how much hypoxic conditions you want to create in the blood. This is a very interesting therapy in that for cancer patients, low oxygen, hypoxic conditions stimulates the immune system and stimulates certain cells of the immune system to get more aggressive. On the other side, high oxygen stimulates the immune system and a different type of cell, T cells, so you can alternate between low and high oxygen and stimulate the immune system by pumping back and forth between low and high oxygen. Very interesting type of therapy, very new.